Moshe, thank you so much for joining. Thank you for taking time out of your day. I excited to talk with you and learn a little bit about you and your new team.
Thank you. It's great to be here.
Absolutely, absolutely. So your job is not an easy one. I find that almost everyone in behavioral health has an interesting story of how they got here. Would you mind sharing yours?
Sure. So my story of how I got here is actually maybe an interesting one. I actually did not begin in behavioral health at all. I was actually going for a degree in biochemical engineering. I was, volunteering and working on the side with special needs. I was recruited back in high school. Got recruited then again to a um, what's now called ComHab, but we used to be called ResHab, which is basically in-home supports to an adult at that time with autism. And again, wasn't really planning on doing anything with it. A friend of mine tried to recruit me to a summer program where initially I was going to say no, I don't want to do this, and he's like, "Come, we'll do it together. It'll be fun." So I said, "Fine, we'll do it together. It'll be fun." And I signed up, and then he actually ended up dropping out. And then I really had like the best 2 weeks of my life. It was amazing. And from there, I got recruited to do these weekend things, and then to a group home. And then just after a while of being in the biochem program, I failed organic chemistry. Realized that this wasn't where my heart was anymore, and I started again with psychology. And then I heard I was doing, Psych 101, the first course, and there was a professor there who was, it was an adjunct professor. So there was the observer, checking on her, making sure she was doing her thing, and she happened to be talking about his topic. So he so he spent like 10 minutes talking about it. I got really interested. I approached him after class and he said, "Okay, come back to me in like a year. That's the time when really to get involved, with labs and stuff." And a year later, I got in touch with him and he said, "It sounds like you're looking for more dealing with kids. I deal with more adults." So he gave me a few other people to get in touch with, and I did. And then really just between that and a few of my other professors that I had, I leaned toward behavior analysis, got my degree, and continued in that path ever since.
That's awesome. That's awesome. Both a realizing of the passion and also just kind of a fun happenstance between things.
Yeah,
Yeah,
definitely.
that's really cool. That's really cool. So, because you're so experienced in your space, what are some of the biggest challenges that families face when starting ABA, especially in your community? And how do you go about helping them through it?
I think there's a range of different challenges in starting ABA. For example, I remember one case that I had that this was already kind of way past things. I was like, I was, I got it. I was with the family already kind of past all of this, but she kind of told me about her experience where, for her, it was about just the diagnosis itself. Like she had been like fighting for this diagnosis for a couple of years already, and then even when it finally hit, it was just like a week of depression just from having the diagnosis. And like again, she fought for this, like she wanted this, she wanted all the services, but just that final like realization of things was difficult for her. And other challenges that I think families face is really just getting services and getting consistent services. Like I know another family that I was working with where they were like in the middle of like a move and things, and so they had like some little like teeny gaps in services, not really due to the move actually, but it was more so due to like a break over the summer, which was like when they were moving in, he was in camp, like all these different things going on. And then they did finally find someone to come and start again. And then he was supposed to come on a certain day. They tried getting in touch and he wasn't able to get in touch and then he didn't show up. And then he didn't, and then he just stopped answering after that. And then it went back to the drawing board of finding services again. And then like probably went like through like 3 or 4 therapists that year before they finally found someone that was with them for 2 years. And then she's finally moving on in her career, and now it's probably been like 3 or 4 months, and they haven't found someone yet. So it really is just the difficulty in getting services and then keeping with building that rapport, and then finally finding someone, and then starting all over again.
Well, turnover in this space is so constant and such a challenge, I think, for most families because they feel like they're finally getting comfortable with a BCBA or an RBT, and then they change and they have to start all over with some new person. Um,
And you really get into a rhythm with the therapist also. On the one hand, like you want to make all your programs very descriptive so that anyone can read them, but at the end of the day, like you can write pages and pages and no one's going to be able, first one, no one's going to read it. And second of all, even if they do, it's still not going to cover everything. But once you have someone who's already familiar with the case and the individual and how you do programming, like you can write much less and they can understand what you mean and then take it and run with it versus now starting over with someone else and then it's 6 months before you probably get to that point.
Yeah, absolutely, absolutely. So, changing topics a little bit, how
hmm
do you go about preparing young adults with autism for independent living and kind of more general adulthood?
that's a good question, and the truth is that it's really case specific, right? Depending on what their level of functioning is. I think that's more of a sometimes I don't know if this is going to be answering your question exactly, but it sometimes it becomes more of a parental educational experience as to what their child is actually going to need to be prepared for. Like on the one hand, you want to really prepare them for everything, give them all the skills that they need, and you have parents that like really want them to learn all these different things. And then sometimes we have to come back and say like all of these skills are great, but like we need to work on the essentials that we know that they're actually going to need to use. So then it becomes a focus on what that individual is actually going to need, in their life.
I think all good therapy should be customized, right? It should always be unique to the individual.
Yeah, Yeah, I mean, there's, I don't know if there's an exact saying, but like, I kind of say that like the diagnosis gets you the service, but we don't treat a diagnosis. We treat a person.
Yeah. Well, if it's not a saying, then you should claim it. That,
Yeah.
that does make sense. That does make a lot of sense. Um, so we are since we are specialists in marketing and advertising for behavioral health, we have to ask some marketing questions.
hmm
How does your team go about gaining new clients right now? What's working best?
So as I had mentioned to you previously, I'm in the middle of a transition between positions.
Yeah.
So I can answer the question kind of on both sides. In the adult world, the way things work is you have staff called support coordinators. So they basically hold the keys to the castle for everything. And while you can advertise in the community and on Facebook and like all these different places, at the end of the day, the support coordinator is really the one who actually signs off on the family obviously signs off on the services, but the support coordinator is the person who makes those connections and puts together the plans to allow the families to get services. So it's a lot of outreach and making connections with support coordinators who really have access for you to all of the families that are looking for services. And then obviously building just a good, not just a rapport, but a good name for yourself so that when families do hear about you, they know that they're getting a good service. In the insurance world, it's definitely a lot different. And right now, my focus is really on making connections with what you would call referral sources. So it's the schools, it's the doctor's offices, and that's a much bigger, to me, what I'm finding is that that's a much bigger hill to climb because it's a lot of, you're not necessarily making connections with people who are actively seeking services. It's a much more passive type of outreach, versus in the adult world, like this work coordinator is going to come to you and say, hey, I have someone that wants services. Can you service them? Here, it's more like the doctor's office provides them with, let's say, a list of people that they can reach out to. And doctors' offices don't only see kids with autism; they see kids with, runny noses, and that's not going to be a referral, right? So it's a much different kind of connection and outreach. So I'm finding it to be a very different kind of connection and hill to climb in terms of getting those referrals.
Absolutely, absolutely. Well, and it's different for different stages too, right? At this stage, you can only accept so much business as well.
Yeah, that too. I mean, that would be a good problem to have, I guess.
It is the best problem. It is the best problem. Last marketing question. What is one marketing tactic or strategy that you're considering or watching in the marketplace right now?
That's a good question. So, I mean, I really am in those beginning stages. So, what I'm trying to do is my initial approach is a more laid back approach, seeing what is more naturally going to take.
Hmm.
So, anyone that's responding well, I try to foster a little bit more. But as it is with, I think, any kind of outreach, you reach out to 100 people, maybe one person gets back to you, and that's it. So I haven't really started yet focusing on those other 99.
Yeah.
and I know that I need to do more work there. I've spoken with some other people that have dealt with not necessarily in the ABA world, but in other similar kinds of marketing capacities, and it's really about finding out when they're in office, getting there, and finding when they have a few minutes to talk. Maybe even bringing a little gift or something just to introduce yourself with, so that it's about finding a way for them to remember you, so that you're more than just another list, in the referral sources.
Absolutely. Anything to make yourself more than just a random name and an
Right.
actual person in their mind. Yeah.
Yeah, so that's probably where things are heading. It's just hasn't we haven't gotten there yet.
Yeah, absolutely, absolutely. Well, it is early days. It is early days, right?
Yeah.
Um, Perfect. Well, thank you so much for joining us. Thank you for doing the work that you're doing in your community, and we appreciate you taking time out of what I'm sure is going to become a more and more busy schedule the longer the days go.
Yes, thank you very much, definitely.